Odds are you know somebody who has high blood pressure or somebody with a higher risk factor for getting high blood pressure. About 9 in 10 Americans will develop high blood pressure in their lifetime, um, as says the CDC. They also list some risk factors, and those include medical conditions, lifestyle choices, genetic and family history, as well as other conditions like age, sex, and ethnicity. Um, High blood pressure can cause the arteries that supply blood and oxygen to the brain to burst or be blocked. They can also damage the arteries through making them less elastic, and then that decreases the flow of oxygen. That can cause heart disease. Bottom line that I'm going to be talking about today is that high blood pressure can lead to higher risks of heart disease, of heart attack, and of stroke. All three of these are not only harmful, but they're all life threatening. Now I'm going to go ahead and tell a story about John Murphy. John Murphy was running a marathon in October of 2005 when he had his first symptom of a stroke. His left eye went blind while he finished the marathon. He actually finished the marathon. And then he went on to celebrate with his family later that evening. And it was then that the whole left side of his body became droopy and numb, and his face also began to appear droopy. He was brought to a hospital where he was diagnosed with a stroke, and he was held for the night for observation. And he actually ended up waking up in the ICU because he suffered further complications from high blood pressure. I'm telling you this because I think it's really important to note that although certain lifestyle choices and being really active, that's really good, but it's also really important to understand that there are so many different risk factors when it comes to high blood pressure, and that although we do know some of the risk factors, we don't actually know um, the entirety of high blood pressure, and it's not fully understood. Um, Even to this day, he still suffers with fine motor skill use and um, vision loss. Um, but the Mayo Clinic does say that it is one of the most common conditions that medication is prescribed for in the United States, and that certain risk factors are known, that the causes and the preliminary onset of high blood pressure is not fully understood. The chances of having a stroke increase after age 55, but I do think it's important to note that about 1 in 7 strokes occur between ages of 15 and 49, as per the CDC. I feel like that's really relevant information for all of us. Um, High blood pressure, like I've said, is really common, and although um, some of you may not have high blood pressure, odds are you do know somebody who does or might develop it at some point. So I really want to go ahead and start talking about one way that you can reduce your risk for high blood pressure or even the harm of high blood pressure if you already have it, and that would be through exercise. The American Heart Association suggests 2.5 hours of moderate level activity per week. That can be walking, cycling, it can be tennis, and Mayo Clinic also backs this suggestion, and they even assert that exercise makes the heart a lot stronger. So it's really good for your heart and your blood pressure. I'm really glad that we were able to talk about high blood pressure today. I've linked some further information about taking steps to reduce high blood pressure. That's linked in the discussion post. And go ahead and tell me your favorite way of staying active and reducing the risk of high blood pressure. Thank you.